To declare the rollout of school-based surveillance system officially launched.
The UK provided 2.1 billion shillings and Ireland 7.1 billion shillings to the United Nations Children's Fund, UNICEF, for Uganda's school reopening strategy, a portion of which is being used to set up a school-based COVID-19 surveillance system. The computer-based surveillance system was launched at Buganda Road Primary School in Kampala.
We are trying to link the schools to the nearest health center because primary schools are in parishes, secondary schools are in sub-county, and in sub-county we have the health center 3. So we will link the schools to a health center 3 where they are testing kits, and these are the rapid testing kits. But time will come, these testing kits will be given to the secondary schools where there are clinics and there are nurses.
The Minister for Primary Education, Joyce Moriku, says the system will help prevent potential COVID-19 outbreaks in schools. But how will it work? A 7-member committee will be set up at each school to monitor learners and record any daily suspicions into the system for health officials to manage.
Now we shall have a tool, a digital tool. Students are reporting on Monday. We shall continue to get their information, and when the digital tool is given to us, we shall have got that, and we work as it is.
We will collect information about the children on a daily basis from every school.
But many schools, especially in rural areas, have limited access to computer and internet. So what will happen there?
We are going to provide a tool that where the schools cannot have the ICT, we will use the hard copy, collect information. This information is entered into the data. So if I am here, I want to know the status of school in Kasese, in Karamoja, I will just click open, I will get to know how the school is doing in terms of COVID prevention and control.
Part of the funds is earmarked for training on psychosocial support for learners who, according to experts, have been through a lot during the lockdown.
For mental health, you don't need the person to go physically and walk into the mental health or a counseling clinic. The e-counseling is very important, and we have the technology. What we need is more training of people who can provide the minimum level of e-counseling for the learners, for the teachers, and for those cases which require professional handling, they can refer them.
So what is the teacher's role in gauging the mental health of the learners back to class?
Learners always have different learning needs, they have individual differences. So after studying them, I can clearly know how best I can handle them.
It's not a very new thing that's coming, except that this time it may be slightly enormous compared to what we have been going through. But if it's bigger than what they can manage, then we can consult psychiatrists or professional counselors.
As schools reopen on Monday, UNICEF says the system alone is not a solution if teachers, non-teaching staff, learners above 18, and the under 18 learners with underlying conditions are not vaccinated. Edward Muhumza, NTV.
A financial literacy coach is cautioning savers about